My name is Christine Apple, co-chair of the Milwaukee Mental Health Task Force, and I'm a psychologist with the Department of Corrections. I'll start out the meeting by doing the ground rules before introducing Mary Neubauer, the co-chair. Thank you for joining us. Please follow these ground rules for our virtual meeting. Everyone will be muted throughout the session. We hope to have time after each speaker for a few questions. Use the chat feature to type your questions. We will answer as many as we can. Sign language interpreters are provided at this meeting. If you need assistance accessing the interpreter, please put your request in the chat. Speakers, please say your name before you speak to help with accessibility. Auto captioning is provided. You may turn captioning on or off. Click on the caret symbol next to the CC Live transcript button at the bottom if you want to hide subtitles or to view the full transcript. At the top of your video screen, you can choose between speaker view or gallery view, whichever you prefer. Okay. So thank you to our partners in the May 8th Mental Health Awareness Month celebration. View the event on Facebook Live, thanks to Montreal Kane and Mira. Reminder, the Mental Health Task Force annual membership drive and the membership drive letter. I believe Barbara put something in the chat already. And Children's Mental Health Week is May 7th through the 13th. Meeting materials are also posted on our website at the link, the Milwaukee Mental Health Task Force.org, and that was already put in the chat by Barbara. I'm going to turn it over to co-chair Mary Neubauer to introduce herself and talk about an exciting event that happened yesterday.
Yes, I'm Mary Neubauer, and I am the other co-chair of the Milwaukee Mental Health Task Force. And I just want to say hello and thank you to our co-sponsors from yesterday for our media event regarding the state budget that took place in person and live at Independence First at 11 o'clock yesterday morning. And it was an amazing event. Our first speaker was County Executive David Crowley, followed by myself. And then next up was Maria Gonzalez Edwards, the board member from Maida House, followed by Katie Schmidt-Hagmeyer, who represented the deafblind community. She's a the one and only deaf therapist in Wisconsin, advocate therapist, who spoke to the issues around the deaf community, followed by Dr. Marie Elena Perez, excuse me. And Maria is the vice president of behavioral health at the 16th Street Community Center, and also the chair of the Milwaukee County Mental Health Board. And am I missing anybody other than, and then our last person to speak was Montreal Kane. And Montreal is the executive director of Mira and Mira Cares. And he also did our call to action, which we'll speak about later. And a special thank you to Montreal for setting everything up. So we had Facebook Live yesterday. So it was an excellent event. We had some media coverage, and Barbara put the link in the chat for Wisconsin Health News. Barbara?
Yes, that's correct.
Okay, Wisconsin Health News did an excellent article. So thank you, everybody, and thank you for speaking. And hopefully the legislature heard what we had to say. So thank you, Christine. And I think I'm next on the agenda. So let me open my phone, because that's where my agenda is. I just closed it. Be patient with me 1 second. I decided to stop cutting down all the trees, and I don't print all my agendas anymore. And I wasn't thinking, and I just closed my phone. So Kelly Pethke is next on our agenda. And I want to do a proper introduction here, so.
Both of our speakers, we're really fortunate to have today
Yes.
because of celebrating children.
Mental Health Month, yes. Go Barbara, just, I need to pull up the, okay, here we go. Thank you. Okay. So, without any further delays on my part, excuse me. Kelly is the administrator for Milwaukee County Department of Health and Human Services, Children, Youth, and Family Services. As the administrator, Ms. Pethke will address Milwaukee County's role in supporting youth, what programs, services, and treatment are provided, and the status of programs in Milwaukee County. Services and treatment are provided, and the status of programs in Milwaukee County for justice-involved youth, as well as plans to bring youth home from Lincoln Hills and Copper Lake. So I'd like to introduce Kelly. Kelly has spoken with us before, and it was very enlightening. Kelly, welcome back, and we've given you adequate time to speak, and so you have 45 minutes. And then hopefully after you're done speaking, the 45 minutes includes time for you to speak, and hopefully we can field a few questions. Thank you.
Excuse me. Thank you and good afternoon, everyone. So yes, I am Kelly Pethke, Administrator for Children, Youth, and Family Services. And I do just want to reiterate, we call it CYFS, Children, Youth, and Family Services. And this includes the children's disability programs of the Children's Long-Term Support Waiver, Children's Community Options, Birth to 3, as well as Youth Justice System here in Milwaukee County. And we are under the Department of Health and Human Services. And so I do have a PowerPoint. It's about 15, 16 slides. I think someone was going to share their screen for me. Thank you. I have a hard time sharing my screen on Zoom. Okay, here we go. So yeah, like I said, about 15, 16 slides. I'm going to go over a wide variety of topics, very high level, but I wanted to make sure there was time to address any questions, concerns that people had. So with that, we can go ahead and move forward in the slide. Thank you. So again, CYFS is one of the service areas within the Department of Health and Human Services. We also have the Aging and Disability Services, Behavioral Health Services, the Housing Services, Management Services, and then Veteran Services. And I always include our mission, vision, and values because this really guides everything that we do at CYFS, which empowering safe, healthy, and meaningful lives, together creating healthy communities, and our values here, which spell out pride. So we can move on to the next slide. So I did want to share, we just released our 2022 DHHS annual report, and this is available on our website. So I would, if you have, it's a great report, it has a lot of information about all the work that has gone on throughout DHHS in 2022. It highlights a lot of the great transformation, work that's been done, collaboration, and then plans for the future of the Milwaukee County DHHS. Talks about where we are in our strategic planning and our 2020, moving forward on our 2025 future state, which is, you know, we started this strategic planning and that seemed far away, and now it's right around the corner. So one of these strategic plans is around our no round door, which I'll talk a little bit further about, and how we collaborate and break down those silos across all of DHHS. One of the focuses of our annual report and everything we do in Milwaukee County at DHHS is around creating equity, ensuring equitable service delivery, and equity across all operations of DHHS. And then some of the major initiatives talked about in our report include moving forward on a new Marcia P. Coggs building. Right now, the Coggs building, you know, is on 12th and Valete, and we have plans to build a new building right behind that one, similar, close to the mental health, emergency mental health complex, but in that same area. It's important for us to stay in the same community that is the building it's currently in. So a lot of work has been going into that, and we'll continue to move forward. The report also includes information about our housing developments, redesign of our behavioral health system across Milwaukee County, talks about enrollment in programming and services, advancement of diversity of service providers, as well as related to specifically to CYFS, the pilot and expansion of their Credible Messenger program. So I encourage you all to check that out. If you have questions on the report, you can also reach out to me or anyone within DHHS.
Kelly, this is Barbara, sorry to interrupt, but is the
No, you're fine.
report posted on the website?
It is.
It is, okay.
It's-
I will try and find that link. Thank you.
I'm sorry I did not include the link. I can get the link for you. It should be on our website. But I will look for the link afterwards and I can send it out. Okay, we can move to the next slide. Okay, so last time, I believe I talked to this group, it was last summer, maybe June or July, and I talked a lot about the integration efforts across DHHS. So I did just want to provide an update. Some of this may look familiar to you if you were part of the discussion back last summer, but I do just want to, again, reiterate the work that we're doing and then provide some additional updates. So the children's integration, which is what CYFS is a part of, the integration is really a part of the no wrong door model, which is really, it's really around no matter what door that families, individuals, children, whatever door that they access through DHHS, we're able to connect them with the high quality, acceptable services that meet their needs no matter what. And if they're not provided in DHHS, then we are connecting them to different resources in the community to meet those needs. So when we talk about children's integration, it's really bringing together the children's disability services of the children's long-term support, children's community options, birth to 3, with youth justice and children's mental health and wraparound Milwaukee. I do want to note children's disability and youth justice at CYFS. The children's mental health and wraparound is under behavioral health services, but all still under the DHHS umbrella. So with the integration, one of the focuses has been on a centralized intake and screening process for children and youth for mental health and disability services. And I'm happy to announce we now have 3 resource and referral line staff. We've gotten down to 1 and then 2, when we finally are at 3, and one of our staff is bilingual, which has been a need for the resource referral line for a while. So as we look at onboarding all the staff, make sure everyone's trained and ready to move forward, we are looking at increasing the staffing for the resource and referral line to another 1 to 2 staff as well. So one of the goals related to the children's integration is meeting the needs of children earlier, preventative, and diverting them from the justice system. And it's really about setting them up for success in their homes, in their communities, and not to be involved in any type of system or justice system, whether it be youth system, adult system. And in doing that, some of the things we've implemented is a multidisciplinary staffing and central staffing process, as well as, like I was saying earlier, having intakes and assessing for children at the very starting point of their system involvement, or even before they become involved in the system. I do want to note too, just real quick. Historically, if prior to the children's integration efforts, if a child were to come into the youth justice system, they weren't assessed for any type of disabilities. They were for mental health. They did, that screening assessment was available, but not disabilities. And what we have found is, and I'll talk about this a little bit later too, is a high number of children involved in the justice system do have unidentified or previously unidentified disability that qualifies them for additional services and support that doesn't have to come from the youth justice system. Okay, and we can move on. Okay, so some further information about our integration efforts. We do have increased enrollment in our CC, or the Comprehensive Community Services, or CCS, and CLTS. And as of yesterday, we had 172 youth who were dually enrolled in CCS and CLTS, which is a huge increase. We used to have maybe a handful of kids that were dually enrolled. So 172, and we hope to be at 200 in the next couple months. As far as our birth to 3 services, we do have, again, as of yesterday, just over 1,400 kids who were being served in birth to 3. And then we have enrolled over 300 kids just in Q1 of 2023 as well. And one of the things we keep advocating for is additional resources for birth to 3. We realize the importance of being able to screen, assess, and serve children in that, I mean, the birth to 3, I think it's just such a critical time in these kids' lives, and being able to have the resources available to provide the services to all kids who are eligible. It's very important to us. Another data point I want to share is we have increased our enrollment in CLTS well over 40%. And it was 40% in 2021, and we have continued to grow. And because of that growth, which is great, like we want to continue to grow. We want to continue serving more kids in the CLTS. But in doing so, we need additional staff and providers to do that. So we do have a current RFP, which is a request for proposals that is open right now. That closes on May 30th. So we're looking to add another 2 to 3 additional CLTS support and service coordination agencies. We are also hiring additional support and service coordinators for Milwaukee County. We just hired 4 new SSCs who are starting next week, and we're looking to hire another 1 to 2 in the next couple of weeks. As well as we're building out the quality and strategic sections within the children's disability programs. Being one of the great things about the integration is now we have the resources across all of CYFS, which includes QA, QI, QC, all quality. We're working on training and onboarding planning, and making sure that we're utilizing the resources across all of CYFS to support the CLTS and birth to 3 and CCOP. We currently have over 2,500 kids in CLTS right now. We also continue to coordinate and collaborate with the Aging and Disability Services to really support the transition of youth from CLTS or adult or youth services into adult services. And we're doing very intentional work behind that. We also have a home and community-based services grant, or HCBS grant. We were awarded that through the state of Wisconsin. And that was effort through CYFS and Aging and Disability Services to target and work with individuals across lifespan who have disabilities. And I know one thing I just want to note before we move on to the data, there was questions, I believe, around the use of mobile crisis. And I don't have the data available right now to answer specific questions. But I do want to say that one of the changes is now MK Milwaukee Mobile Crisis. And instead of being separated into youth and adults, they now work with everyone, regardless of their age. So there's not 2 separate teams anymore. It's all one mobile crisis team. And that can be accessed through 211. It is access and triage through 211. There is still, and that is separate from the trauma response team. The trauma response team is still an available resource for individuals and families, but all referrals for trauma response team go through either the police or fire departments as of right now. But I do want to note there's a lot of discussion and planning going on, and there just be on the lookout for changes to that coming in the future. Okay.
Kelly, this is Barbara. Sorry to interrupt, but I just wondered if you could further clarify with mobile crisis, because I think some people have the understanding that there isn't a youth mobile crisis team anymore, and they think that service is no longer available. So I didn't think that's correct. Could you clarify what that is and what the process is and the capacity?
Yeah, they do still serve children. So that, yes, I do want to clarify. It's just not 2 different teams anymore. There used to be a children's mobile crisis and then a mobile crisis for adults. It is now one mobile crisis team, and they will work with individuals from children all the way up, like the whole lifespan. It's just not separated out anymore. So all calls for any type of mobile crisis will go through 211.
Kelly, are there people, when they combined, are there still people who are trained and understand youth?
I believe so. That's my understanding. That, I mean, they're trained. So I know they get training on adults and youth, and I don't know what exactly the training looks like, but I can find out additional information. Let me just make note. So I know there's training. I just don't know exactly how much or what it looks like related to youth.
Thanks.
Okay. Anything else on that? No? Okay.
Sorry,
Oh,
Kelly,
no,
this
go
is
ahead.
Barbara again. You know, it sounds like maybe might be a little bit more follow-up, but I think the perception that people have is that there isn't capacity with mobile crisis right now. So
Okay.
if you're able to clarify that, and or if there is capacity, are there ways that we can all work together to better communicate that to the
Mhm.
community and to schools and, you know, other youth serving
Mhm.
agencies? Because I think people prefer to have a response from mobile crisis rather than calling law enforcement. But if it's not timely,
Absolutely. Yeah.
sometimes people don't have an alternative.
Yeah. Absolutely. I will say, as far as capacity, I know there's issues with capacity across. I'll say definitely there is capacity issues with mobile crisis, but a lot of DHHS, if not all. I can speak to the CYFS side. We have had high turnover and just a very difficult time recruiting and retaining staff. Same with our providers. A lot of our contracted providers have been experiencing staff shortages. And I know that that has impacted the mobile crisis team as well. So I will take that back to the BHS team, and I can let them know and get additional information around it. Because I can just kind of speak generally, it's definitely an issue. And I can speak to some of what CYFS is doing. I don't know if that's an interest. But well, I'll just say some of what we're doing like large hiring events now. We just held one last Wednesday where it's like we're doing it at Zufari. It's on the spot interview and tentative job offers. That has helped. We have from last week, we have 18 people that we're looking to hire as a human service worker. We've also looked at the criteria for all of our positions, like what is, looking at education, experience, any certifications needed, and looking at that through an equitable lens as well. And how can we ensure that we're getting the right people? 'Cause that's important too. We need people that want to do this work and will be a good fit for the work. So we don't continue to have the turnover as well.
Kelly, this is Mary Neubauer from the
Yep.
Mental Health Board. I believe last Tuesday at a meeting, Mike Lappin said there were 45 open crisis mobile positions.
Wow. Okay. I didn't realize there was that many.
35 or 30, it may be 35 or 40, 35 or 45 positions.
Okay.
It's significant.
That is very significant. Yeah, that is very significant. And I have to say, that's not like unheard of at this with I'd say the last year and a half. Just seeing the staffing shortages across a lot of social services. A lot of our stakeholders in the courts have experienced staff shortages. So it's definitely an issue. Okay, I can move forward here. Okay, so moving on to, I believe there was some interest and questions around some of the data around justice involved children. So here's just some data points that I was able to pull. We do have just over 1,100 kids in the youth justice system. I want to be clear, these are kids who could be pending court or on probation, deferred prosecution agreement, or could be in corrections as well. So this is the whole system. And And of just based on some data we pulled last year, it's estimated that 60% of justice involved youth have an undiagnosed mental health issue prior to them coming into the justice system. There's extreme needs around substance use and mental health resources. And then another estimate, there's that there are over, oh, I'm sorry, there were over 200 justice involved youth served in wraparound services last year. And then going back to the data we pulled around estimates, over 80% of justice involved youth had a mental health diagnosis, and then over 89% had an IEP or special education interventions. And this is from 2021 data that we have. And so just trying to show that the kids that we serve have complex needs. And something that's not reported here is around the trauma and the impact of trauma on the kids and families and communities. And that's something also that we're very much aware of and include in all of our work and case planning with our kids and with our families. And we can go to the next slide. So when we talk about what are we doing in youth justice right now, one thing I mentioned earlier was the continued expansion of CCS and CLTS, but that also includes justice involved kids. We're seeing more and more kids who are in the justice system also being eligible for CCS and for CLTS, where they were never assessed, screened before their involvement. We also launched the initiative to increase screening for disabilities in youth who are system involved. And then you've heard me talk about credible messengers in the past. The credible messengers are really really transformative mentoring. It's individuals who live and work and are involved in communities where our children and families are living, and they're really deemed credible by the children and individuals and families, and they are really to make these connections with youth that are they're not system involved. They can't belong. They don't go to the courts. They don't do court reports. Really trying to keep it separate from the courts because it's really about these relationships, and the relationships that people build with youth have the largest impact on their outcomes later on in life. And so with that, we last time I was here, I think we had over 100 and some kids connected. Now we have over 200 kids who have been connected with a credible messenger. And then we've had, what is this? Over 250 youth from the justice system, disabilities, behavioral health programs enrolled in we call it our collaborative employment programming in 21 and 22. And this is a DHHS initiative to get kids exposed to different career opportunities and pay them for this. So we work with different community. We work with Employ Milwaukee, MPS, Youth Advocate Programs, Bloom Therapy, and I think a couple others. And we're going to do that again in 2023. So we focus on the summer months because that's the time when kids are out of school and often need something positive and productive to do. So we're happy to be able to continue that and get more kids employed and exposed to other career opportunities this summer. We've also increased coordination and expansion of all of our service provider network. We have new services as well as building capacity for our current providers. And I'll talk a little bit further about that next slide, I believe, or in a couple slides. Yep. Thank you. I want to talk a little bit about our Community Healing and Family Support Initiative. And this is a DHHS initiative. We're still working through the actual implementation of this, but what we're hoping to actually be able to implement in the next couple months. What we're looking to do is expand on our Credible Messenger program. So right now we have 5 agencies that we contract for credible messengers, but we're looking to expand that to, number 1, have a formalized communication and capacity to refer to the trauma response team. So we're looking to formalize what that process would look like. We're looking to create a girls only credible messenger program. So working with a local community-based partner who will create a team and they'll only work with justice involved girls. Because one thing in general, girls in the justice system don't have as many services and supports that are for girls only. So that's another expansion. And then looking to expand our community credible messenger capacity. So right now, majority of referrals for credible messenger come through the youth justice system. They can get referrals from law enforcement as well. But because we've had a wait list for credible messengers for a long time, pretty much since it was operational. So we want to create a team specific to work with referrals from community only. And it won't have to be just from law enforcement. It could be we're trying to expand who could make a referral for a credible messenger. So again, that will depend on how big the team is and how many kids they'll be able to serve. And then we also are applying right now for a federal grant to implement advanced peace. And the advanced peace model is similar to a credible messenger, but it targets those individuals, youth and adults who are at the center of gun violence. So we'll work with the Advanced Peace. It's Advanced Peace Fellowship. And it's a fellowship where we could serve up to 20 individuals at one time. And it's a 3-year project. So we'd have one cohort of 20 for 18 months, and then another cohort of 20 for another 18 months. And again, this is targeting those high-risk individuals who are engaged in gun violence throughout Milwaukee County. And then we can go to the next slide. So continuing the community healing and family supports, we're looking at the coordination and overlapping of all the children's system of care effort, which includes CYFS, behavioral health services. And we're looking at creating positions that focus on offering individuals and families support, assistance, advocacy, whatever their needs are around housing and economic support, parent-family engagement, employment, education-related support, as well as mental health, substance use help. So again, these would be new positions that will be working across all of DHHS and really being more community focused or community facing rather than internal system facing. We're also doing some work on community facing prevention messaging and programming. So working around communication and marketing, as well as being able to offer community trainings and events throughout Milwaukee County. And again, a lot more to come on this as we're working through the implementation phase, but I wanted to share here because I'm very excited about being able to do more of that community facing, which really gets at the root causes, preventative work that DHHS is really focused on. And now I just wanted to do a quick slide about youth engagement and accountability, because I know there were some questions around what happens with youth, how do we engage them, and things of that nature. So wanted to talk about, when we talk about youth engagement, all of our staff are trained. Youth engagement is huge because if you can't engage the youth, you're going to lose them. They're not going to be involved in their services or programs or case planning. It's very hard to make changes if they're not engaged. So everything we do is around youth engagement. And ways we do that is through what we have. First thing is our YASI, Youth Assessment Screening Instrument. This is what we use to assess and help case plan. But we case plan with the youth, and what's tied into that is our growth focused case management. Because the growth focused case management really looks at the future, setting goals for that youth. It's short-term, long-term goals, action steps to get to that goal, and then really focused on what that youth sees for their future. Because a lot of times you talk to kids and they haven't really thought that much far ahead. Or it's a way of engaging the youth and getting their buy-in to make the changes as well. We also have services and programming across the spectrum. And I talked a little bit about those last time I was here, but the services range from predisposition or prior to the court getting involved all the way to what is we call the deep end of the system, which are kids who might be in a secure placement. We have risk-driven youth contact standards. We have the youth team collaboration process, We utilize carry guides as another tool. It's just a tool, one tool that we have. And all of this is really about engaging the child, but also one of our primary focuses is also that family, because the youth justice system in general tends to focus on the youth, but the youth is going home, and they're going back to their homes and their communities and engaging their families, the parent, guardian, or whoever that child sees as a support for them is important. And there are strategies and things that our staff can use if a kid is not engaged. And it really varies based on the needs of that youth, what works for that youth. We also, a lot of these kids do have court orders. So we always follow what the court order states, and really do what we can to get the youth to participate, because it's not just showing up, because a kid can show up and just go through the motions, but really getting their buy-in is important as well. And then we can move forward. And I realize I'm getting at the end. Okay, I'll hurry up. We go to the next slide. I wanted to provide an update on Act 185. I think I provided an update last time I was here, and we've had a lot of change, a lot of progress since that last meeting. So Act 185, just a little bit of background, is around the closing of Lincoln Hills and Copper Lake. And per Act 185, the state could fund up to 90% of the design and construction of what is called a Secure Residential Care Center for Children and Youth, or CRC, with the counties contributing the remaining 5%. So we've been working on this for the last 5-6 years, I'd say. We had submitted an application years ago. We initially we received 15.2 million. This was 8.4 million short of the requested amount. And at that point, we deferred acceptance. And last time I was here, we were still in the deferment process, or deferment of the grant. I do want to know at the same time, Division of Juvenile Corrections daily rate continues to increase. So the current rate is $1,178 a day, which is just about $430,000 per year per kid. But that is proposed to increase to $1,246 a day in July. And so since last time I was here, well, first, I guess I forgot, legislation was approved to build a type 1 facility in Milwaukee. This, I do want to reiterate, this is the state of Wisconsin, DOC, not the county. So since last time I was here, we met with DOC. We did submit a request for an additional 15 million in addition to the 15.2 million, which would be needed in order for us to move forward with the CRC. At that point, the state of Wisconsin did allocate 13.1 million for a total of $28.3 million for $28.3 million grant to move forward with the design and construction of a CRC. And then we can move forward. Just wanted to update on the DOC activities, because they are, a lot of people get confused between what is county and what is state. So when you talk about a Milwaukee type 1 facility, this is the one that's proposed on the northwest side of Milwaukee. This will be state run. So what they're working on the design with the architects. They are working on capital budget requests because they need additional funding. So that process is moving forward on the state side. There is another proposed location for another type 1 facility in Dane County. And I'm not sure if that will move forward or not, but that is on the table. And then we have Mendota. Mendota currently only serves boys involved in the justice system. And in order to go to Mendota, it's a mental health facility. In order to go to Mendota, you have to be sent to corrections up at Lincoln Hills, and then they will send you to Mendota. So part of Act 185 is expanding Mendota. So they are expanding, and they're on pace to finalize the phase 1 of their expansion by early 2024. They will now be able to serve up to 20 girls at a time. So this will be new. So as of right now, girls cannot be served in Mendota, but in the future state, they will be able to. And then there is a request for additional funding to staff the expansion, which I believe is still pending approval. And I'll have to look into that too. So that's just update on the type 1, the state activities. And then moving back to the local activities. So our CRC, what we're proposing is to serve 32 kids. which includes up to 4 beds for girls. The CERSI, we're in the design phase right now. But what will be included in the CERSI is an area for administration. There'll be 4 housing units of 8 beds each. There'll be a new admission release area. We're expanding the healthcare and the behavioral health center. We are expanding the food service, and we'll have a culinary arts program. We'll have its own visitation center, as well as expansion for education. So the CERSI will be a separate part of what is currently at the Vel R. Phillips Detention Center. So what we're proposing is to build onto the current detention center and then remodel a certain area of it. So a total of 32 beds. The programming and services are what's important for CERSI, and the relationships and people that are actually implementing the program. So our goal is to focus on whatever the unique needs of the youth are. We need to be able to serve any youth that is sent to us, and every kid in the CERSI will have to be court ordered there by a judge. So what we're looking at, building programming around skill building, positive youth growth, community restoration, family engagement, and then ensuring that we have a commitment to healing of that youth and family and racial equity, because everything we do should have the lens of the equitable lens to ensure that we're not providing more harm to children that we're serving. Okay, and just a quick, this is just a quick timeline for our CERSI. Right now you can see we're in April, May. We did get approval from the county board last month to accept the state grant. So the goal is that we would start construction early 2024 and be finished at the end of 2025, beginning of 2026, and be operational at that point. And this is a very high level view, but I do want to note we still are pretty far out from actually being operational. There's a lot of work that has to go into this. And then last slide here I have is just what are we doing to bring youth home? Because we have 23 kids in corrections today. We have 1 girl in one girl in Copper Lake. I'm sorry, and 22 boys in Lincoln Hills. So some of this I think I've already talked a little bit about, but really expansion of youth services for the joint intake, really doing more work around prevention and diversion, which is what I was talking about, the community health and healing initiative. We are building out services for kids in detention. We have a post-dispositional program implemented right now that we are slowly making changes to the programming. We're building out services specifically for justice-involved girls and other special populations of justice-involved youth, and really focus on reducing the use of secure placements for youth in a safe and equitable manner. And we're doing a lot of this through ARPA funding right now, and then we also have opioid funding. I do want to note this is one-time funding. So everything we do needs to have the goal of when this funding is not available anymore, how are we going to be able to sustain? And that is always in our mind as we're planning services and programs. So some of the things funding, I talked about the credible messenger expansion, doing more work around girls and special populations. We have built in a lot more services for kids in detention, as well as community, bringing in new providers, new services, and being able to really expand the whole continuum that we have to offer. We also have early childhood and family support project, focuses on birth to all the way for early childhood, but we're really kind of expanding, just being able to focus on primarily elementary age children. We do have participatory budget. We have 2 projects for participatory budget, one on the early childhood side and one on the youth justice side. We also have diaper mission support we're providing. We have a new project coming that was just approved last month, the Mentoring Mindsets, focus on mentoring children throughout Milwaukee County. And that is the end of my formal presentation. And so I think I have a few more minutes, and I'd take any questions, comments, things that you would like me to look further into. Any question? Oh, I'm sorry, check the chat. So there's a question, any of the children who are deaf, hard of hearing in enrollment to receive mental health services too? I would have to look at the data around that. I mean, that would definitely would qualify. Well, if they'd have to be screened and assessed. And if they qualified, we would definitely be offering that. But I don't know. I'd have to look and see how much data we actually have. So I'm just making a note of that.
Great.
Nicole, all right. Nicole,
Okay.
you have a question.
Oh,
Hi, yes, thank you for coming, Kelly, and talking about this. I'm just curious about some of the gendered services when you say that you're trying to expand services for girls and other special populations. Is that including our trans folks and non-binary and two-spirit folks and gender non-conforming? So all that on the spectrum, is that what that is intending to capture?
yes, absolutely. So we number one is the girls population. And when we say special populations, we definitely are focused on youth who identify LGBTQ. We have some new agencies we're working with. We're also looking at when kids, because one of the issues we often have are kids who they're in out-of-home care. And how do we ensure that their needs are met and they're safe and they're able to flourish as well? But that is definitely one of the when we say special populations, that's one population. But really, we made that broad because we recognize there's such a wide variety of needs that kids have, and we wanted to be able to use this funding to really work across the whole spectrum of whatever the kids' needs are. That is one of our priorities.
Thank you.
Yep. Any other questions? I don't think I see any hands.
Yeah.
Oh,
Just have a question about on your one slide, it showed the types of programs that you were going to have these kids be training in, but they were all very low level jobs, something that they really wouldn't make a living wage at, culinary, stuff like that. There's a program on Channel 10 about this fella in Milwaukee who's taking kids and showing them how to build things with wood and stuff like that, which would seem to have a lot better potential for getting these kids into jobs that are not subsistence jobs. Thank you.
Oh, yeah. Sorry, I think you're referring to our DHHS summer employment program. If so, we work with. So some of the people we work with is Employ Milwaukee. We work with MPS, Youth Advocate Program, Bloom Family Therapies, and there's I believe there was one more, but really there's a wide variety of opportunities for kids. So like last summer, some of the opportunities were around detailing like cars, auto related, t-shirt making. One worked in a barber shop, learning some of those skills. Couple of culinary arts. Trying to think. Oh, one was another restaurant. But what they do, depending on who they're connected with, they look at what is the kid interested in. And then they, like youth advocate programs, will go out to different local agencies and businesses and see what opportunities exist. And we try to match the kid up with their interests, but also try to expose them to new and different opportunities. And I can talk in our CERSI, our future CERSI, we do want to bring in people to show different employment opportunities as well. So what we talked about is some HVAC, bringing in some people, some mechanical engineers, some things like that, just to, we do, I always have to be careful because it's in a secure setting. But there's ways that we've visited other sites and they've been able to do this and really provide that exposure to a lot of different opportunities for kids.
Hey, Phyllis. Phyllis?
Yeah, sure, thanks. I think Denise might have been before me, but you want me to go ahead? I'm Kelly. I'm just wondering how you decided how many beds for the Cersei, and was it 32 plus 4 for girls, or was it 32 including the girls?
Yep. So the number of beds has been a topic of discussion for years. We started out with a higher number, went down to a lower number. We landed at 32 based on just looking at the data of kids served, but also on resources available. There's only $28.3 million funding available. There is no more additional funding. We've advocated for, spending or for funding for the last 2 years. And so the 32 beds is what we feel we'll be able to actually build and also operate, because not only do you have to build it, but you also have to operate. And being able to operate Cersei is expensive. It's more expensive than our post-dispositional program now, because there is a lower staffing ratio. Right now it's a 12-to-1. A Cersei is an 8-to-1. And then we also want to make sure we have meaningful programming and services, and that also has additional costs associated with it. And then we have the education and all the needs that we have to provide our kids. So we realize people feel that's not enough. And then I know there's other people that feel that that's too many. But looking at the data and the resources available, this is where we landed. And the 32 includes the 4 beds for girls. But the design is, so they're 8-bed housing units, but one of the 8 beds can be split into 4 and 4. So that we can, if there are girls in the Cersei, we can serve them, but there's not, like right now we have 1 girl that would be in the Cersei. Sometimes we don't have any. And so we could use that then just, it's like a wall that can be moved and make it into a 8-bed for boys.
Hey, Denise, we'll wrap it up here.
Great, thank you. I hear a lot of talk about goals. How are you going to direct some of these positions to match the goals that you're looking to meet? It seems a little bit overwhelming as far as the amount of staff you're going to have to hire.
So I don't know, I'm not sure if you're referring to trying to look at my slide, the staffing for community healing initiative, or just in general, but
just in general.
Yeah.
I see your overall goals and
Yeah.
what you'd like to achieve, and it's going to be a lot of people.
Yes, absolutely. And like I mentioned, it's the people that make the difference. So we will definitely be hiring. We continue to hire for all positions right now, but as we move forward with our Cersei and with our community healing initiative, that will require people, and there will be that specific marketing for that. But we have a pretty robust onboarding for new staff as well at CYFS. There is several modules we have staff go through. So it's in class learning, it's on the job training, it's shadowing. We have 1 supervisor who works with all new staff in the beginning, kind of like a training team model. But I definitely agree. It's gonna take people to pull this off. And we need to make sure that we have the resources available to do that.
Okay.
Great, thank you so much.
Okay. Thank you so much, Kelly, for being here and sharing just a ton of information and detail. And we welcome you back another time.
Perfect. And I will put, do you want me to share my contact information or
Yeah, yes, that would be great.
I'll put it in the chat for everyone.
Right, and we did put the link in for the annual report.
Perfect. Great. Thank you.
Thank you.
Okay. Thank you, everyone. Have a great
Christine?
day.
Thank you.
Thank you, Kelly. Now continuing on with children's mental health updates, we will move on to the Wisconsin Office of Children's Mental Health. Linda Hall, the director of the Office of Children's Mental Health, is up, and I did see her, so take it away. She's
Okay,
going to
thanks,
update us on the
Christine.
status of youth. Sorry, go ahead.
No. Well, good afternoon, everybody, and thanks for having me back again. I think you're my favorite group to talk to. Although I have to say, I really like being with you in person. So I look forward to doing that one of these days. I am going to, let's see, is someone else is going to run the slides? There we go. Terrific. Now I just have to be able to, now I've got to adjust my screen so that I can actually see the notes that I have here. Sorry, just a minute. Okay, here we go. So I'm going to talk about children's mental health and about what we see as priorities for children's mental health right now, and a lot about advocacy, because this is just a really important year for all of us to turn up our advocacy fires and make children's mental health be well known, because this is our opportunity to have increased funding and support for it. So with the next slide, I'll show you that I'm going to do just a few facts, talk about the 2023-25 state budget and the opportunities for advocacy there, and then some more about the ideas we have about how to celebrate Mental Health Month and Children's Mental Health Week. So as I look at who is on today, I realize that some of this is going to be repetitious for folks. I hope that it won't be too repetitious. And if you have things to interrupt and add to it, make it more interesting, that'd be great. So feel free to interrupt me whenever you like. Next slide, please. So here are the facts that our kids are not doing well. We have, 1 in 3 kids, or 1 in 5, I mean, is engaging in self-harm. We have 1 in 4 girls seriously considering suicide. And I don't know what you're hearing, but I'm hearing more and more cases of suicide, even in recent weeks. The Youth Risk Behavior Survey data tells us that 1 in 3 high school students feel sad or hopeless almost every day. And that same data source tells us that 1 in 2 kids is feeling anxious. They're feeling anxious about a lot of things. We know that they're anxious about safety. They don't feel safe. They're anxious about guns. They're anxious about academics, and they're anxious about, what happens to them after high school. And if we look at, we dig a little deeper into this data and look at what's happening for kids of color and LGBTQ kids, the data are even more alarming. So we're definitely in a youth mental health crisis. It's not just because of the pandemic. It's been developing for a good 10 years, but it's really time for us to address it. So next slide, please. I think all of you know that the social determinants of health are really important. They drive 80% of mental and physical health outcomes, and those have been really accentuated during the pandemic. These are really, the non-medical factors that influence health outcomes. And the stress that has been caused in recent years from the pandemic contributes to that, as well as just the inequities in our society and our system. Next slide, please. So we know that one of the biggest stresses for families is financial. And we know that when parents are stressed, that the kids are more likely to be anxious and depressed. So really addressing these financial issues for families is important. You'll see also that youth identified income and hunger as stressful issues for their families. We know that families of Black and brown kids experienced more deaths to family members, so that's obviously a stressor. And we know that a third of all kids in Wisconsin is on Medicaid, so we know that low income is a big factor here. I think that you may also be aware that the extra money that was funneled to families during the pandemic and is about to run out moved about 50% of the kids in poverty out of poverty. So we're really, on the cliff here again, and things are going to get worse before they get better. Next slide, please. So all of this means that, we have this important opportunity with our state budget to make some big investments in children's mental health. The next slide. The governor, as I'm sure you've heard, declared 2023 the year of mental health, and he put major investments into the budget. $500 million for mental health in general, with $270 million for Get Kids Ahead, which is really the focus of the school mental health activity that it has been funded. And part of that includes $36 million for school mental health professionals. So that's the social workers, psychologists, and counselors at school. And another $1.1 million for staff training on evidence-based strategies. This funding for school mental health is just so critical because we know that while only less than half of kids get treatment for their mental health conditions, the 75% of those who do are getting their treatment through school. So these investments are really important. Now, I'll talk a little bit more about the budget as we go forward here. Next slide, please. With all of the good things the governor put in the budget, I don't want to go through all of them. That would take too long. I'd keep you here well past dinner time. So I'll just do a little bit of overview here. Our office asked for one position to help us carry out our work, especially our work with lived experience and youth. And so that is still in the budget. You probably have heard that the legislature took the governor's budget, set it aside as they usually do, and is starting from scratch. So all of these items that the governor put in are not necessarily going to show up in the final budget. Our item so far is still in because it was just a dollar amount. They take out everything that has any kind of policy related to it. So some things are still in, but many items have been removed. So, but children's mental health is sprinkled throughout different departments. So the Department of Health Services obviously has a lot of mental health issues in it. From this list that you see on the screen, I just want to call your attention to crisis and urgent care. That has a substantial investment from the governor's budget. Psychiatric residential treatment facilities would start a program to do a pilot, essentially, of this psychiatric residential treatment. This is a level of care that's between inpatient hospital and residential or treatment foster care. And it's a level of care we don't currently have in Wisconsin that can be really helpful for kids who need some more formalized and a secure setting for their treatment. So we hope that will continue to stay in the budget because it fills a hole in our continuum of care for kids. Youth crisis stabilization is also important because we want to get more kids stable in their community, and youth crisis stabilization would create some more stable funding for regional crisis centers that are being developed. So we want those to continue to grow and be available for kids. Qualified Treatment Trainees is a program that is funding the work of people who have finished their training, their mental health training, but are still having to get more practice hours in before they're licensed. And so the Medicaid does pay for that service now, but many insurance companies don't. And so we want these people to be able to do this, because actually it's the people, the newer people in the field, who are most interested in working with kids at school. And so making that a payable option for them so is important for students getting treatments. And it's also important in terms of people making it to licensure so that they can have a career in mental health. I know that many of you are very interested in peer specialists, and one of the items that's in the governor's budget is expansion of Medicaid certified peer specialists. We've got people who've been trained to be peers who are not currently able to find a position, and so this would help them. The last item on this page, yes.
Mary Neubauer, I believe that was taken out.
By joint finance, yes, it was taken.
Yeah, by joint, yes. So as I said in the beginning, they set everything out, and so then it's a, you know, we can advocate for things to be added back in. So that's part of the process. I mean, I'm sorry, Mary, go ahead.
Yes, I believe once joint finance takes it out, it cannot be added back in. The only way something like that could go back in is to be written in in specific legislation.
It depends on, yeah, how much language is needed to do that. And they must have determined that there was some language related to this, but we'll see what happens towards the end of the process when they get to putting in a big bill for all of the DHS items. Barbara, do you have something to add to that?
Not really. I mean, you know, my understanding was along the lines of what Mary had shared, sadly.
Yeah. Well, as I said, I think there are many things that that make their way back in. It depends on how they develop the process. There have been times in the past where they say, if someone can get a certain number of people to support something being added back in, then the finance committee might add it back in. Because they always change language. In some cases, it's never purely just funding. There's always some language that's put in. So it definitely makes it harder if finance has pulled it out, but I wouldn't say that it's a complete loss. So the last item on this list would very much be in that bucket of hard to get back in. We are advocating for a language that would require insurance companies to cover qualified treatment trainees, to pay for them, and to allow them to work in schools. This definitely gets in that bucket of, oh, this is new policy. We'll be working to see if we can make some headway in this area, because we just think it's so important. But that's a big lift to make that happen. Next slide, please. Just want here to note that there are some important mental health issues in the Department of Public Instruction and the Department of Children and Families budgets. We actually lead off our list of children's mental health issues that are most important with these two items that are in the Department of Public Instruction budget. So it's that comprehensive school mental health that would take the existing grant program and turn it into more stable long-term funding, which would be helpful in terms of schools being able to know that they have this money year after year. They don't have to reapply for it and wonder whether they're going to get a grant. And we know that some schools don't have the time or the skills to apply for grants. So we think these things are top of mind in terms of what we need for kids. In the Department of Children and Families budget, there are important items for the Wisconsin After 3 program is targeted to improving literacy and math skills for low-income children. And that's really important for their development. And then another item in the DCF budget is support for childcare. And this one is really about training and technical assistance for early care providers so that we can reduce the number of preschool expulsions, which is also characterized by more Black boys being expelled from childcare and preschool than any other group. So, and preschool expulsions are actually more common than expulsions from K through 12. So really important. And we have, in our focus on getting kids connected, we've identified this issue as one that, training and technical assistance is critical to the people providing childcare having the skills and the support to actually respond to kids' behaviors in different ways and to be thinking about the mental health issues that might be behind some of those behaviors. The next slide, please. So these are our recommendations. I've touched on them a little bit. We are kind of categorizing them in these 3 categories. One is access to mental health services and treatment, then the continuum of care, filling the gaps in our continuum, and then youth voice. So I think I've talked about all the ones under the access section and most of the ones under the continuum of care. So I really already hit the highlights here. I didn't talk very much yet about youth wellness. We, during the pandemic, we did a number of listening sessions with teens and young adults around mental health. And we've been engaging a lot with the adult advisors of peer-led mental health programs in our high schools. We have over 200 high schools and middle schools in Wisconsin who already have a peer-led mental health program active. And when we are connecting with these youth, we are hearing from them that they have ideas about how we should be addressing the youth mental health crisis, and they want to be actively engaged in bringing about solutions. And so we are working already with the adult advisors of these groups to start bringing youth together to hear what they have to say about it and support them in terms of advocacy for youth mental health. And so that's really what we want to do. We've learned as we started to do this, we've learned that there are a number of youth councils. Some you may have heard about. There's the Youth Advisory Committee in DCF. We have folks that in a group that we use, that DPI has another council. So we want to bring all of those councils, the leaders of those councils together to be more effectively using resources, learning from each other, and supporting youth and actually being able to raise their voice about what we should be doing for the youth mental health crisis. We also want to do this because youth voice has been shown to promote mental health. It activates the very skills that nurture and protect mental health. So those are like decision-making skills and persistence to achieve goals. It activates social skills and interpersonal skills. And it also creates a sense of belonging and connection, which is really important to agency for youth around making a difference in the world. And we certainly have seen that when we've brought youth together, that the sense of belonging that they have and the excitement that they have about working with other youth is just infectious. So we want to support that energy and create more opportunities for youth to speak up around mental health. then I wanted to share, in the next slide, I wanted to share the focus that one of our significant partners is using for the budget. This is the Coalition for Expanding School-Based Mental Health. Their priorities, as you can see, are growing the state investment in school mental health funding, building school mental health workforce, and advancing parity coverage for student mental health. I think those, I like this. It's a nice way to sum up the kinds of things that we were already talking about that were on our list. We're very much in sync with them. I think that the way they presented it is nice and clear and a helpful way to bring it together. So I wanted to share that with you. On the next slide, they have the coalition, which has also done some advocacy training during the budget time, has put together this nice timeline for how the budget process goes. And as you can see, in May and June, we're sort of at the Joint Finance Committee action stage. Then they will move into the full legislature working on the budget towards mid to end of June. And then presuming that they actually pass a budget by June 30th, so that we have a budget for the next fiscal year that starts on July 1, they will actually get that budget to the governor, who will be working on signing it and possibly doing some vetoes in it. So we're at this joint finance stage, which is an important stage for advocacy. Next slide. So here we have put a bunch of materials together for people to use for advocating around children's mental health in the budget. This flyer, which has links to finding out who your legislator is available on our website. You can see the address there. And it includes the information on our priority list that I already spoke about. And then it includes these links for how to make your voice heard. The next slide. With the next slide, we're talking that we wanted this year to, let's see, I think I am looking for a slide that says budget advocacy at the top. There we go. Thanks. So we wanted to make it really easy for people to speak up for children's mental health. And so we have on our website this budget advocacy page where you can not only click to find out who your legislator is, you can also download an email. And when you find out your legislator's name, you'll get the address for your legislator. But there's actually an email that you can just copy and paste into your own email settings and make it easy for you to do a email to your legislators, especially if they are on the finance committee. And even if you're not in a finance committee member's district, if you letters to them or emails to them make a difference, and we're really encouraging people to do that. Does anybody have any comments about the budget process or questions before I move into Children's Mental Health Week?
Linda, it's Mary Neubauer. I don't know where it fits. It might fit somewhere later. I'm not sure it fits into the budget stuff. And if I can ask it later, let me know. I just wanted to talk a little bit about youth as peer specialists. So,
okay.
Someplace we can talk about that.
Yeah. Let's hold on to that thought. Let me just go through the Children's Mental Health Week's
Okay,
stuff,
great.
and then we'll get back to that. I'll make a note of it. Yeah. Okay.
Hey there, it's
Yeah,
Monty.
we're interested.
Quick question about the budget.
Yeah.
So you mentioned earlier that if there are enough people galvanized to basically advocate for a particular area of the budget, that there would be a possibility that it may be reconsidered. Is there any particular items that you would like support from? You don't have to answer this. You can put this in an email or something, but is there particular areas you want us to advocate for in any strategy that we can work on collectively to make sure that the effort that the governor has put in is not completely neglected?
Yeah, well, thank you for that question. I would say that our number one issues on our list, which are the school mental health issues, changing that grant program into long-term sustainable funding is our number one priority. And when you look at the email that we've drafted, you should see that in there as a priority. So sending emails to the finance committee members, and we have those listed when you go to that page. You can see some of the finance committee members there. That would be the best thing to do right now. And we'll continue as the budget process goes along, and the finance committee starts to talk about health and mental health. We'll be getting out more information about it and maybe making some more suggestions as to the message that we'd like to have you share with the legislature. And then the best way to get that information from us is to sign up for our newsletter. And that is also, I can put the link in the chat later, but you can sign up for our newsletter on our website.
Thank you very much.
Great, thank you. Let's see, and Denise is saying, Denise is asking whether we can still make comments even though the finance committee has closed their public comment period. Yes, they always start out with a few public hearings, and those are in fact over for now. They're not going to be doing any more of those. But the process, it's still a process, and that's why we're recommending that you can send emails to the finance committee. And their website, that you can do it through ours, or you can go to their website where they have some links to send it to the finance committee, and you can send an email, and they say it will go to every member of the finance committee.
I believe they closed the portal for taking comments.
Oh, did they?
On the day of the last hearing, which was the 26th. I mean, you can still email to all finance committee members, but the portal that they had set up, it was my understanding, isn't going to be available any longer.
Oh, okay. I guess the last time I checked was right before the last hearing, so I didn't notice that. Yeah, thanks, Barb. Okay. Well, I will make sure that we have the list of all of the finance members on our site so that you don't have to go looking for them. Okay, anything else that people have to contribute? Okay, if so, then I'd like to move on and talk a little bit about Children's Mental Health Week. You will see that for many years, local and national advocates have been using the Children's Mental Health Week to raise awareness about children's mental health. But as we are really wanting to, along with other folks throughout the nation, we're really wanting to move beyond awareness. I think that is one thing that happened during the pandemic, is that more people realized that we all need to invest in our mental health in order to be well. And so we want to move beyond awareness and acceptance of mental health to action. And that's what we're focusing on this year, is what are some action steps that you can take? So next slide, please. We have created a whole section on our webpage that has ideas for you on what you can do. It includes a copy of the proclamation that the governor issued for this week, which is Children's Mental Health Week. It has social media, visuals, art that you can use, and suggested messages to go with them, and more activities. I'll show you some more of those. And then this, you see down at the middle and the bottom, is the envelope again, where you can get to emails to send to legislators. So on the next slide, what we've done is to group the kinds of actions that can be taken into individual, interpersonal, or community actions and organizational actions. And so here first is the writing to Joint Finance Committee, which we already talked about. On the next slide, you'll see some ideas for what you can do in your community. So you can find the data on the health of youth in your community. You can host a youth mental health first aid training. Mental Health America is encouraging people to light up landmarks in the community, light them up green. So we're currently talking with the Children's Museum here in Madison to see if they might be able to do that. And then you can be involved in promoting 988 or fundraising for local activities around mental wellness. So lots of ideas, and these are also listed on our website with more detail and more ideas. Then in terms of businesses, action that businesses and or other organizations can take, people could, in a business, might coordinate with other youth serving organizations. They might coordinate paid volunteer events. Some of these are listed on the next slide. An organization might make a new effort to include peer specialists or just speak with clients of their organization about mental wellness and think about mental wellness days. The next slide, we've got a whole 7-day action plan for you. We're already on Tuesday, I guess, but there are lots of ideas for individual actions that you might take during the week. And this whole chart is also on the webpage. So lots of things for individuals and people to do, with links to other resources on our webpage, like our feelings thermometer, our mental health crisis card. With the next slide, I wanted to let you know that Martina Golan-Graves was very helpful for us in doing a message about Children's Mental Health Week. This recording, with the help of our communications team, where there is a recording with Martina talking about mental health and the importance of action. It's about 1.5 minutes long. You can get it right by looking at our homepage, which is children.wi.gov. You go to the homepage, she's the top thing on that page, and it's a very nice message that you might want to share with others in your organization, and maybe that would be your contribution for today in Children's Mental Health Week. Listed on this slide also are some of the events that are still coming up on children's mental health. So Children's Mental Health Day is traditionally Thursday of the second week in May, and so that's this coming Thursday. And then Mental Health Action Day is on May 18th. And we know that we are cooperating with the governor's office in doing a press release that day. So just, really take a minute to check this out. It's a very focused and really pleasant message to watch. You'll want to take a look at it. So together we can make a difference. And there's lots of things that you could do during this week and the rest of the month. We're challenging ourselves to get something out on social media every day, and I made it today. So getting the message out in social media and contacting the finance members are really the most important things to do right now. So if that really concludes my presentation, but if we have a little bit of time, I'd be interested if people would want to put in the chat something that they think they might be able to do this week to take action on children's mental health. So I'll give you some more suggestions that you might have seen earlier. So check in with a young person who's in your life and ask them how they're doing. You could contact your legislator, do some postings on Facebook. We have this Zoom background that you see on my screen is available for you to download and use. And maybe you have some idea about something else that you might do. Well, people are thinking about that, what they'd be willing to commit to this week. I'll get back to Mary's question about youth peers. Actually, Mary, do you want to say a little bit more about, what you wanted to talk about on that?
Yes, I would. I know as the years earlier, there was some activity about trying to train young adult peer specialists, and ran into some difficulties with the curriculum and life experience and the testing and all of that aspect and element of things. With the various councils that have taken place and the work that's been done over the last 2 to 3 years, has there been any other discussion within the groups of the youth about wanting to do anything as peers for each other in some way, shape, or form, I guess? Maybe not as formal as a certified peer specialist.
Right. Well, what we certainly have heard from youth is that they want to know what resources are available, because they want to be able to help their friends who may be having some kind of mental health issue. And so that's part of the reason we want to get really active in supporting these youth-led programs at schools, because we learned over, as we talk to youth, that they are sometimes in a school that actually has a school mental health program and they don't know about it. So there's a lot more to do in terms of information sharing. Right. And we know that youth want to do that. So that's not quite a peer specialist role, but we know that that's kids want to talk to and have the information to share with their friends. And I think we all know that teens are more likely to talk to their friends about some of these issues than their parents. They'll go to their friends first. So we want them to be equipped to have good conversations.
Right.
And so that's one aspect of it. There have been some concerns about, what's an appropriate age for a youth to be a peer specialist. And I think that is, in some ways, is still being worked out. But I think if Phyllis and Barbara can help me, I believe that in the Department of Health Services, there are folks working on a youth peer curriculum to try to fill in some of to address some of those issues that you're raising.
I've heard about parent peer specialist. I'm not sure about a youth curriculum.
Yeah, there's the parent peer specialist. So I just left the certified peer specialist advisory committee, Linda, and so I wasn't aware of anything happening within that realm. But just backing up to what you were saying, I'm involved with the theatrical production pieces in my own voice. And when we were traveling around from school to school and interacting with kids in high schools and middle schools, it was always so interesting and amazing how engaging kids were about wanting information around mental health and sharing their own personal stories.
Yeah.
And because there was nobody to hear them or listen to them. And and that's not changed. I mean, in light of the pandemic and how they've had to grow up so quickly and so silently, it's even changed. And as the issues around suicide have expanded and suicidal ideation, our kids are really in dangerous places. Our youth. And
They
it's a
really are.
big concern to me.
Yeah, yeah, it is a big concern. And that, you know, we've got a tremendous shortage of mental health professionals. That's something that we're not going to fix soon. So it's going to take time. So that's why we're really, engaging around school mental health, because we see that we've got youth who are wanting to be leaders and helping their peers be informed about mental health. And where there are options, I think, to use the school as an incubator in some ways to try out some different strategies of getting to kids at an earlier point. When you consider that from the first display of symptoms for mental health or mental health condition to treatment on average is 11 years, there's a lot of kids getting missed. And we know that untreated mental illness for children can extend into chronic adult mental illness. So we really want to stop that as much as we can. I think that these the programs like Sources of Strength, Hope Squad, Mental Health First Aid, these programs are creating some space for youth to be more engaged and more informed and to help their peers. So those are important. They also show that they also create a better school climate and a better sense of belonging. And we are watching the data around belonging because it is tied to well-being. It's tied to kids showing up at school and improved academic performance. So there are lots of things that we can work on in that arena, and that's what we're focusing on. I'll also say that part of our agenda for a statewide youth wellness network is to get some young people interested in mental health service, mental health treatment, being mental health professionals, seeing that as an option, a career option.
Thank you, Linda.
All right. Well, if there's nothing else.
I think, Paul, did you have your hand up before?
Yeah, I just wanted to make a quick comment that at my daughter's high school, the school psychologist trained a cadre of students to look for kids with symptoms that were mental health related. And they picked up my daughter and took her to the psychologist. And that process did more good than the psychiatrists and psychologists that we had seen on our own when she got in with that group. And she went through a whole lengthy process that the others had never suggested. And now she's making a lot of money out in the West Coast. So she done made good.
So Paul, was it the type of response that she got from the mental health professional that was different, or was it that she was part of a group activity?
Both. That the psychologist was working with this group of kids, and they came up with other ways to do things. Just a quick example was a CHIPS petition that we put forward so that she could get the kind of help she needed. That was something that nobody had ever suggested before that, and it was a godsend.
It's nice to hear success stories. Yeah, nice to hear it works. I mean, I think in terms of school mental health, there is a lot of good activity going on around the state, and we're collaborating with the coalition in Milwaukee area to support their efforts to get to more schools and offer more services. So while the youth mental health crisis in general is large and looming, there are a lot of people engaged in it, and really excited to make a difference in kids' lives. Well, thank you again. I look forward to the next time that you invite me to come and talk.
All right, Linda, thank you so
All
very
right.
much.
Thank you.
Thank you. All right, the next item on our agenda is policy update, state budget, and Milwaukee County Mental Health Board. So Barbara Beckert, you're up.
Thank you. And thank you, Linda. You provided us with such a wealth of resources and also a lot of good budget information, which, was above and beyond. So thank you very much for that. I am just flipping over right now to our meeting agenda, which is posted on the website, and I'll just put the link in the chat. I know I did it earlier, but it only appears for people who were on at that time. So I'm going to put it in the chat again. And I just wanted to follow up and reinforce what Linda talked about, the importance of continuing to advocate for investments in mental health in the budget. So yesterday we had our Milwaukee celebration of Mental Health Awareness Month, and kind of a rally to advocate for investing in the mental health in the budget, and to realize the vision that Governor Evers had laid out as 2023 is the year for mental health. So we have some good resources for you on the webpage for this meeting that we hope will be helpful for you, and that we encourage you to check out, because right now your voice is a really important one. So one of those is an action alert, and it is Speak Out for Mental Health in the state budget, and I'm putting that link in the chat as well. And just to kind of walk through the process of what we're suggesting folks do right now, all state legislators, so we all have a state senator and state assembly representative, they all have an opportunity to have some input on the budget, and they may not be on the budget committee. If you have a state legislator who's on the budget committee, then that's great. They're in a more influential position. But if they aren't, they still have what's called a budget buddy. So they have someone who is on that joint finance committee who they have been assigned to, and who they can reach out to and try and have an impact on the budget. So if you look at our action alert, it walks you through how to find out who your legislators are. There's also a link to the Joint Finance Committee page. And then we suggest different ways that you can contact your state legislator at this point with your budget priorities. And you can call them, you can email them, you can ask to meet with your legislators in the district. And I think if you're able to do that, that's always impactful to have that face-to-face conversation. So encourage you to consider doing that. Although Joint Finance Committee has finished their budget listening sessions, individual legislators are still having them. So check with your legislator's office. You can ask to get on their email list, so you'll find out about those listening sessions in advance. And another great thing to do is follow them on social media, if you're on Facebook or Twitter, and you can sometimes share your ideas in that way as well, in a positive way to, give them some ideas of what your priorities are. So we've got a few key points for your message. Legislators want to hear from their constituents, the people who live in their districts. So we are encouraging you to introduce yourself, share your name, where you live, if your job, if it's relevant, or your volunteer work, or your lived experience, whatever might relate to the mental health issues. And be sure to include your home address, because that's what establishes you as a constituent. When I write to legislators, as a community member, I usually include my address in my signature. And I mentioned in the first sentence, I live in your district, and I'm writing to ask for you to consider some of the issues that are important to me in the budget, as someone who lives in your district and is active on mental health issues or whatever it might be. And then talk a little bit about what's important to you. Stories are always really impactful, and I think Linda mentioned about that. So if you can share how mental health concerns have impacted your life or the life of a family member or people you work with or care about, that helps. And then make your ask, let them know what needs to be done to fix the problem. And we have a whole list of proposals in bullet format, so they're short, in our action alert that's on the website. So for example, one of those is increasing funding for peer-run recovery centers and peer-run respites, so more people can access peer-delivered services. They aren't available throughout much of the state, so there's a real opportunity there. Another one is providing more equitable access to mental health services for people with hearing loss, and funding a new program that's in the governor's budget to coordinate support for mental health substance use disorder service delivery for people with hearing loss, and a number of other proposals for kids and adults. And so we hope that that gives you some ideas of what you can do if these are important to you. It gives you kind of a menu that you can pick from to contact your legislators. So just want to pause for a minute. Are there any comments or questions about where we are in the state budget and how you might be able to take action? All right. Well, we really hope that you'll find the resources provided on the Mental Health Task Force website useful, and Linda has provided a great array of resources as well from the Office for Children's Mental Health. So send us an email or give us a call if you have any questions. We're happy to be a resource. I'll turn it back over to Mary now to wrap things up on the policy front.
Okay. I have a little bit more to say than just policy. You know, we were very involved as a task force around harm reduction and getting the fentanyl test strips co-sponsored by the Mental Health Task Force. And now the vending machines are being placed and have been placed in the community. And on June 28th and 29th, actually a first ever harm reduction conference will be held in Green Bay. And it was just announced that scholarships are going to be available on a first come, first served basis. And they will be prioritized and available to people who receive harm reduction services, programming, and or resources. So for example, overdose prevention education, naltrexone, fentanyl test strips. It doesn't preclude providers or other people. So what it is they put out a survey, meaning the Department of Health Services. The survey was put out Monday, and it will only be out through tomorrow, Wednesday the 10th, and scholarships will be announced on Monday the 15th. And it covers 2 nights housing, and the cost of the conference for 50 people to go in person, plus an additional 25 people to attend virtually. And so if anybody is interested, or you know somebody that may be interested, Christine, could you put my, do you know my mental health board email address? Do you have that email address?
I can see if I have it.
If you could put that in the chat, please. If you are interested or know somebody that is interested, have people respond immediately, like today, so that I can send them this information, or you can get this information off the Department of Wisconsin Department of Health Services website for the Wisconsin Harm Reduction Conference. And so it's a very, very, very quick turnaround. So what it is, there's a 6-question survey that you take. It asks some very basic questions. And they're gonna use a rubric to score these questions, and that's how they'll determine who is getting these scholarships. So
Mary, I can forward the email to the task force if you'd like me to do that.
that would be, okay, I
that be
can do
helpful?
that. Yep.
I
will-
have it up right here and the email up
Okay.
right here. I can
Yep,
forward it.
Yep, I will do that. Because it's a,
Okay, so do you want me to do it? That's what I.
Yep, yep.
Okay,
yep,
All
I'll
right.
forward it to you.
no,
Did
I
I-
have it. I
Oh, you
have
got
it.
Yeah, I've
right
been
here.
working with the conference lead on this.
And
I-
I'm also putting the link in the chat.
Okay, because what I've tried to do is work with Milwaukee County to get funding for scholarship for people to go with lived experience and community members. And it was such a quick turnaround time, we couldn't do it right now. And they were not initially going to offer scholarships, and now they are. Denise, you've got a question.
When I pull it up, it says, unfortunately, there are no more scholarships available when you click on the link.
Scholarship, it says no more are available. They haven't even,
Yeah, it does.
oh,
Yeah, it says there are no other scholarships available.
I put in the chat what it says, so I'm not gonna send out the email.
okay,
Apparently, they're all taken already. They must have had a quick response.
that's weird because they said they weren't even gonna score them until the 15th. Okay, sorry about that, folks. I apologize.
You just probably had too many people apply.
Yep. So I apologize.
No worries.
Okay, so update on the brief update on the mental health board. At the last board meeting on April 27th, our finance person, Tom Lutzow, who's been on the board since the inception, was given a proclamation by County Executive David Crawley. And Tom will be finishing his term on the board in May. Tom has his PhD, I believe, in finance. So we're looking for additional people. He was in health finance. He previously was the director or CEO for iCare. So if you know anybody that would be interested in being on the mental health board with an expertise in health finance, they can fill out submit their resume to the county executive to be considered for the mental health board, for the finance position for the mental health board. And the information that defines that position is located in Act 203. Somebody can look up Act 203, and it tells what the finance position criteria is. So, so we'll be getting into the budget aspect and elements of for the mental health board. So the next meeting of the mental health board is, there's a mental health board meeting on June 15th. That's a regular board meeting, and those are available still by hybrid. I mean, still virtually, excuse me. They're supposed to be looking for a hybrid option, and I need to question what's going on there. So the finance committee meets at 8 o'clock and the mental health board meets at 9. And then So I believe on the agenda for that meeting will be the introduction of, let me not say that, on the 22nd of June, at 1:30 is public comment. The Finance Committee will meet at Washington Park, and there will be the budget presentation. So that's a finance budget presentation, public comment, Thursday, June 22nd at 1:30 at Washington Park. So for people to get that on their calendars. And we really need input about very specific things about what people want money spent on. And what I can tell you is out of next year's the opium settlement dollars that are coming for next year for 2024, 15% of it will be able to be spent on substance use for alcohol, aside from opium addiction and opiate addiction, rather, opiate use, excuse me. So it will be able to be spent on alcohol, which doesn't typically happen. So that will be for 2024. So that'll be out of this next budget. So please think about all the people with alcohol addiction that don't get treatment, that need to get treatment. And we need to get creative. All the single men that don't get treatment, and because there's a priority list of people with an opiate addiction, pregnant women that have an opiate addiction or opiate use first, and pregnancy, and as the list goes down. So I really encourage people to be there, and that's really what I have to say about the upcoming mental health board meetings. So thank you. Thank you. Please tune in to the mental health board. I mean, the mental health task force website. You can get the link for the media event yesterday. Take a look at it. It was an excellent event, and have a wonderful evening, and we will see you in June. And our June meeting is going to focus on housing, and specifically housing difficulties and rights in housing to resolve housing issues, I guess, is where it's landing. Correct, Barbara?
Yes, housing rights and resources. Thanks, Mary.
You're welcome. Thank you, everybody. Have a good evening.